Hi everyone, this is Chris, and in this PowerPoint presentation, I will be talking about patients' perspective as they navigate through the US healthcare system. In order to understand more about the story, we need to know about the patient's background. In this case, this is a 75 years old Chinese American woman, initial JC, and she has been on Coumadin. Concurrently, she also takes this Chinese herbal supplement called Dangui, and it is known to interact with Coumadin. And I believe, according to Thai 2006, it enhances the therapeutic effect of Coumadin. Therefore, one day, unfortunately, she fell and she developed a bleed and she had to be hospitalized. So, lab work in the ER showed that her INR level was 6.0. Now, she adhered to everything that the physician told her to do as far as diet goes. So, what went wrong in this situation? Um, I believe, in JC's perspective, the doctor never asked her about any alternative or complementary medicine that she takes at the same time with Coumadin. According to the Ngol-Metzger model for culturally competent care, out of the five domains, I believe JC Storage falls into the patient provider communication. Within this domain, there are three things I would like to talk about. The first one, disparities in patient provider communication. Second is the differences in communication styles, and also the lack of communication about complementary and alternative medical practices. So, what happened in the story? What went wrong? What had happened that caused the unfortunate event of the fall, the bleeding, the high elevated INR level? So, from the patient's perspective, the first thing that we should pay attention to is the lack of knowledge. Um, a lot of patients are not aware that there are interactions between the Western medication that they take and their traditional Chinese herbal medication. Another thing too, some patients will not disclose their alternative medicine that they take, not intentionally. Sometimes they just don't think it is important enough. They think that is natural, it derived from plants, so there should be no harms in taking it, nor would it has any interactions with their medications. And also, considering JC's cultural background, many Chinese American or patients who are Asian or Chinese descent tend to be less expressive, both verbally and non-verbally. So, and then according to Ngô Metzger's article, that patients who are more expressive tend to fare better with their healthcare provider compared to those who are on the less expressive side. From the provider's perspective, lack of knowledge is an important factor. In this case, the provider probably is not aware of JC's traditional medicines, as is common in many Asian cultures, especially in the Chinese culture. At the same time, the provider probably assumed that JC understood all instructions. Um, Maybe the provider even think that JC would know not to take any or would discuss with the provider about any alternative medication that she takes. So, what are the potential solutions to the situation? what could be done differently that could promote a better outcome for JC. For from patient's perspective, education is probably the most important. Um, by teaching the patient about the potential drug interactions with herbal medicines, that would prevent patient from just taking random herbal supplements without consulting with a physician first. And from the provider's perspective, um, what should be done was the provider should have asked if there's any alternative therapy medication that the patient takes at the same time that they do with the prescribed medication. And also, by understanding a little bit about the background and the cultural perspective of the patient, the provider should have perhaps encouraged the patient to disclose or share more information and encourage the patient to ask more questions about their treatment plans, any side effects, or any potential drug interactions. Thank you everyone for listening to my PowerPoint presentation. I hope you enjoyed it.